Doctors, they are the lifelines of a nation, the ones who put us back from the brink when life hangs by a thread. Becoming a doctor in India has always been a Herculean challenge as well. Years of grueling study, relentless exams, and long, exhausting internships, training programs, all before even getting a shot at specialization. To become a specialist, the stakes are even higher, as they should be, right? You literally decide if someone can manage your life or not, handle you in that delicate situation in those minutes and seconds that can make a difference. Hence, every mark, every percentile counts, every key information matters. But is that about to change? For NEET PG 2025, the Health Ministry has now slashed the qualifying percentile to record lows. General category candidates who once had to clear the 50th percentile can now qualify at just 7th. 50th, 7th. SC, ST, OBC candidates, including PWBD, can now enter counselling at 0 percentile effectively, no cutoff at all. In fact, if you score minus 40 and are from a backward category, you are still eligible for round 3 counselling of PG. That's your postgrad medical seats. Now just imagine that for a minute. You sit through an exam for 3 hours and still qualify for, you don't even have to actually sit through an examination and still qualify for a shot at specialization. It's hard to know what to call it really. So what's the justification? The government says over 18,000 PG medical seats are lying vacant across India, even as thousands of MBBS graduates wait for a chance. With so many seats empty, lowering the cutoff will expand the eligibility, fill these seats and give already qualified doctors a shot at specialization. The ministry stresses that merit is not being compromised. Admission will still be strictly counselling based. Now, according to NEET PG rank and candidate preference, of course. Now, I don't know how many of us are really convinced by that rationale. A huge number of doctors clearly aren't. They say, is this not promoting mediocrity? Are we not prioritizing seat filling over academic standards? And can we trust the doctors next time we visit them? So, some are even going ahead to say that the quality of future specialists could be impacted if candidates who previously didn't meet the cutoff are allowed to go in. However, it is important to note at this point that revision in cutoffs have happened before as well. In 2023, for example, the qualifying percentile was dropped to 0. In 2024, it was lowered to 5, from 5 to 15 percentile to address similar vacancies. Right? And now we understand that India needs more specialist doctors, so why not? Those are both sides of that story, but the big question is whether lowering the cutoffs is the right way to get there. Is quantity now going to be more important than the quality of doctors that this country produces?